हमारे प्रिय सहयोगी और गुजरात सरकार में संवेदनशील स्वास्थ्य मंत्री श्री नितिन भाई पटेल जी, हमारे सेक्रेटरी और कमिश्नर हेल्थ गवर्नमेंट ऑफ गुजरात श्री जेपी गुप्ता जी, WHO रिप्रेजेंटेटिव इन इंडिया डॉक्टर हैंक बेकेडम, हमारे यहाँ की मेयर, गांधीनगर की मेयर श्रीमती हंसाबेन मोदी जी, सम्मानित मंच, पब्लिक हेल्थ प्रोफेशनल्स, मीडिया के, प्रिंट मीडिया और इलेक्ट्रॉनिक मीडिया के साथीगण और हमारे वरिष्ठ सहयोगीगण, मुझे असीम प्रसन्नता है कि इस 43rd कॉन्फ्रेंस के शुभारंभ पर मुझे आप सबके साथ मिलने का, बातचीत करने का मौका मिला है। इतनी बड़ी संख्या में हेल्थ प्रोफेशनल्स, वो भी पब्लिक हेल्थ प्रोफेशनल्स एकत्र आएंगे, ये मैंने कल्पना नहीं की। आपकी संख्या को देखकर मैं आश्वस्त हो रहा हूं कि स्वच्छ भारत के साथ साथ स्वस्थ भारत भी होगा, इसमें कोई कमी नहीं है। Friends, first of all, I would like to thank the Indian Association for Preventive and Social Medicine and the Indian Public Health Association for hosting this event. It's the need of the hour. It's a very important issue, and the deliberations are going to be very meaningful, and the outcomes will be certainly path-breaking for all of us. The discussion and the points delivered by our Honorable State Minister, Shri Nitin Bhai Patel, which was blended with his practical experiences, which was blended with the realities which one faces at the grassroots level. The observations of the WHO representative, Dr. Hank Beckendam, and the keen observations given by him on the issues related to finance and the policies, how health has to go forward. The same way Dr. Sanjeev, who gave a brief report how NHM has worked and how public health programs are being implemented, and the very keen observation by Professor Sanjay has been enlightening to me. Certainly, all these observations together and the deliberations which you are going to have for the whole day, the all issues which are going to come, I as a representative of the Government of India would like to assure that in Narendra Modi ji's government, public health is an utmost priority, and utmost priority will be given. That is what I would like to assure. The theme of the conference, the sustainable development, is a very apt, timely, and really very meaningful theme which you have come forward in this conference. Just now in 2015, we did good with the MDGs. After the Millennium Development Goals, we are going for the Sustainable Development Goals, the SDGs. And it is the right time when this theme is to be enunciated, discussed and decided. Friends, a lot has been said about public health. I had an experience to be a health minister in a state earlier, and then now I've got the opportunity, by the blessings of the Prime Minister, to lead the health sector. A lot has been said about it, but I feel, seeing the size of the country, the political scenario of the country, health being a state subject, with many limitations health has gone forward in leaps and bounds, that is what I'd like to say. Although much is to be done, but much has been done also. If we talk, sometimes you know what happens, I feel very sorry that sometimes we are compared with other countries. Somebody comes out and says, Cuba mein to aisa ho raha hai. Somebody comes and says, France mein to aisa ho raha hai. I say, do you know the population of France and Cuba? When people come to know the population size of India, they get mesmerized. They get disturbed. They say, how do you manage this? When we talk about the political system, we are proud to say that India is the world's biggest democracy and the largest democracy which we have. It is a federal structure. Health is a state subject. We are able to deliver in the Lahore, Spiti and Leh Ladakh area, far flung, which is snow-peaked at this point of time. We are there to take care in Kerala, where all types of waterborne diseases take place. We are there to take the challenges in the tribal areas of Chhattisgarh, Bastar districts. We are there to take care of the tribal areas of Maharashtra. And still, out of all this, we are going forward in the health sector. Let's not see in the negative way, we should start seeing in the positive way. Lot has been done, and I really salute the health workers. I really salute the ASHA workers. I really salute the health professionals who have been working at the grassroots level. The level of literacy which we have, the level of health consciousness we have, the level of problems we face, still we are going forward in that direction. That is to be understood and taken in the positive way. In the first half of the 20th century, we were facing communicable diseases. That was our challenge. We partially overcome it. We were able to do it. हम उसके ऊपर काबू कर पाए. लेकिन हमारे 3 challenges हैं. Number 1, the unfinished task of the communicable diseases. Number 2, the challenges of the non-communicable diseases. As economy is growing, as affluence has come, as the people quality of life has improved, there has been a challenge to the health. The lifestyle diseases are now coming into our life. Diabetes, hypertension, respiratory problems, cancer is on increase. So we are not only fighting the communicable diseases, we are also to fight the non-communicable diseases. And this non-communicable disease is something which we should understand. It is very expensive. The out-of-pocket expenditure is the maximum, and that is the challenge that it lies. Not only that, the new types of pathogens are taking place. The new types of interventions are coming. The new types of communicable diseases are coming. A decade before, nobody knew about dengue. A decade before, nobody knew about the swine flu and H1 and then N1. And we feel satisfied when we say that the pathogens have not changed. It's the same H1N1, which we know how to cure. So I can understand the difficulties with the public health professionals feel. And then health is also an intersectoral approach is needed. The problem is somewhere in the local self-government, but we are the residual. As said by Dr. Sanjay and Dr. Sanjeev, that we keep on increasing the beds, we keep on increasing the testing facilities, we keep on increasing the training of the doctors. But do we take care of the other aspects also, how it is happening? So these are the challenges which we are facing. But as we are positive and we have to take a lead in this direction. So as said by our Honorable Prime Minister, Shri Narendra Modi ji, who made a baseline of the policies, saying Sabka Saath, Sabka Vikas. Everybody's participation and everybody's development. This is the baseline. This is the formation of all policies which we make. If we talk about health, it's the Swachh Bharat and the Swasth Bharat. Swachh Bharat is primarily related ultimately to the health. Swachh Bharat rahega to Swasth Bharat rahega. Prevention is better than cure. So we have to work on that direction. The same way when we talk about Beti Bachao, Beti Padhao, though this may be related to a different ministry, but primarily it is the gender equation. And it is related to health. The same way, the Swavalamban, all these programs ultimately are in the, which we say has to be monitored and has to be taken care by the health department. So there are policies which have been taking place and which we are trying to intervene. If we talk about MDGs, I must say that National Health Mission has done a good job. If we talk from 1990s to 2015, as Dr. Sanjeev said, he was correct, that at that point of time, it was being optimistic. But now you will be happy to note that when 2000 has ended and MDG has come to an end, we are on the track, we are very much on the track, that is what we have to understand. IMR, MMR, maternal mortality ratio, IMR under 5, tuberculosis, HIV, malaria on the downward trend, pulse polio eradicated, maternal neonatal tetanus eliminated, working closer for Kala-Azar, working very closely at the district level for leprosy eradication. At the national level we have eradicated. But at the district level, yes, there are cases. We are trying to pin down. We are trying to see to it that how do we address those issues. And that is why we have selected 184 districts of the country, not state-wise, where the indicators are poor.